Ketogenic diet is also known as keto diet. Keto in ketogenic signifies ketones, and genic signifies genesis or production. Classically, ketogenic diet has been used for the treatment of epilepsy in the patients, but recently ketogenic diet has been successfully tried in the treatment of obesity. There are 4 types of ketogenic diets. Classic ketogenic diet has 90% fats, 4% carbohydrates, and 6% proteins. Medium-chain triglyceride ketogenic diet has 70% fats including 60% medium-chain triglyceride fats, and long-chain triglyceride fats. Along with this there is 20% carbohydrates, and 10% proteins. Modified Atkins diet has 65% fat, 10% carbohydrates, and 25% proteins. And lastly, low glycemic index ketogenic diet had 60% fat, 10% carbohydrates and 30% proteins. For an average 2000 kilocalories diet, a very low carbohydrates ketogenic diet has carbohydrate content of only 50 grams per day, or 10% of total energy intake per day. Whereas, in low carbohydrates ketogenic diet, carbohydrate content is 130 grams per day or 26% of total energy intake per day. Treatment of obesity could be done either by reducing energy intake, by diet, medicines or bariatric surgery, or by increasing energy output by doing exercise or non-exercise movements. Traditional dietary treatment of obesity has low fat and high carbohydrate content, which might not be effective, as obese people prefer highly processed foods containing simple sugars rather than complex or raw carbohydrates. Low-fat diet could actually encourage the consumption of sugars and refined carbohydrates that can worsen weight problems, and increase abnormal lipid levels, especially in insulin-resistant individuals. Mechanism by which ketogenic diets act is by inducing a metabolic conditions named physiological ketosis. Main energy source of brain normally is glucose, as brain cannot use fatty acids for energy production. But in fasting or ketogenic diet state, there is very low carbohydrates and physiological levels, so brain needs alternate source of energy. This leads to ketogenesis in liver, producing ketone bodies. Normal blood levels of ketone bodies is 0.1. In ketogenic diets they reach a maximum of 7 to 8, and in condition called diabetic ketoacidosis it is more than 25. There are many theories on how ketogenic diets works in the body. Some of the theories are reduction in appetite due to higher satiety effect of proteins, effects on appetite control hormones, direct appetite suppressant action of the ketone bodies, reduction in lipid production and increased destruction of lipids, greater metabolic efficiency in consuming fats, increased metabolic costs of formation of new glucose in the body, and the thermic effect of proteins. Apart from weight loss, there are additional benefits of ketogenic diet, like reduction in blood glucose and glycosylated hemoglobin levels, reduced total cholesterol and blood triglycerides and increased HDL cholesterol, and reduced need of diabetes medicine. Acetone, which is a ketone body, is very volatile and is removed from the body by lungs. This leads to fruity breath. This fruity breath is a normal phenomenon which could occur when fasting, when on low-carbohydrate diet like ketogenic diet and after exercise. Very low-carbohydrate diet, compared to low-carbohydrate ketogenic diet, leads to greater reduction in body weight, triglycerides and diastolic blood pressure. Also, it leads to greater rise in LDL cholesterol and HDL cholesterol. Side effects of ketogenic diet could be nausea and vomiting, reduced blood glucose, lethargy, constipation, weight loss, mineral and vitamin deficiency, inflammation of the pancreas, kidney stones, short stature, bone loss, and abnormal blood lipids, as there is no research which has been done to show long-term effects of ketogenic diet. With present scientific evidence, ketogenic diet can be used safely for a limited period of 3 weeks to few months. Thank you for watching this video. Make sure you subscribe to Health Now TV, and press the bell icon to stay up to date with all the latest updates from this channel.